This is our first class on orthodontics, right? So today we will be discussing about the basics of orthodontics, starting with the common diagnosis and radiological examination, etc. Okay, so what is basically orthodontics?
Orthodontics is a dental specialty that corrects misaligned teeth and jaw problems using braces, aligners, and retainers. It enhances oral health, improves function, and creates confident, attractive smiles for lasting well being.
The benefit of orthodontic treatment extends far beyond just a pretty smile. Okay,
Orthodontics is important because it improves oral health, corrects misaligned teeth, enhances chewing and speech, prevents dental issues, and boosts confidence.
now let's discuss the orthodontic diagnosis, which is a cornerstone of successful orthodontic treatment. It is a multi-course and comprehensive diagnostic process is paramount. It allows the orthodontist to accurately identify all problems, understand their etiology, and formulate an individualized and effective treatment plan. Now, no two patients are exactly alike. Therefore, no two plans should be identical. Whenever you are seeing a patient, orthodontic patient, say for example you have two or three class 1 malocclusion patient in your OPD. Okay, now all three cases are different. All three cases are of class 1 malocclusion, but that doesn't mean that the three treatment plan will be identical. Okay, so there may be class 1 malocclusion with midline diastema. There may be class 1 malocclusion with your anterior crossbite. Okay, so all patients are individual, so all treatment plans should be individual. Okay,
Orthodontics treats every patient differently because each person's teeth, jaw structure, and bite problems are unique. Personalized treatment ensures accurate alignment, effective results, and long term oral health improvement.
next is your dental history, where you will take history of any other previous orthodontic treatment. If there is any history of any dental trauma, extraction or restoration or root canal of the patient, you will see the periodontal status, whether they are any severe chronic periodontitis or not. You will see for the patient's TMJ health, whether the occlusion is balanced or not, whether there are any dysfunction in the TMJ complex. Okay, so you will take the detailed dental history, and the next part is social and behavioral history, where you will check the psychological part of the disease. You will see for etiology. You will look for if there is any habit of the patient, like thumb sucking, finger sucking, tongue thrusting, nail biting, clinching or grinding, that is bruxism. Okay, and mouth breathing. So when you see these habits are there in the patient, you have to consider for habit breaking appliances, because this will severely impact over your proposed treatment plan. Okay, and next is patient's expectations. Okay, as I was telling you, you have to understand what is the patient's demand from your treatment, so whether the demand is realistic or not. Many a time many patients wants demand some things that are actually not possible. As a orthodontic practitioner, you cannot provide that result other than surgery. Like for example, you have a class 3 malocclusion patient, skeletal class 3, and it is a severe class 3 patient, and they want a perfect smile with a class 1 without any surgery. This is not possible. This is simply not possible. So you have to understand what is the patient's expectation, then you have to plan your treatment accordingly. And you have to understand what is the main motivational force behind the patient, whether he or she is referred to you by any other of his colleagues, whether he or she is doing the treatment solely by the peer pressure. Okay,